Why should you choose Integrated Touch Education Services for your continuing education? One of the really cool things about massage is I think that whether you feel like you know what you're doing or not, when you're engaged with someone and you're working and you're doing your thing, that some really wonderful things can happen. And a lot of times that can make us a little insecure in our knowledge of what we're dealing with, because we may not fully understand everything that happened, but something really positive happened. And that's a great thing. That just kind of transcends that you don't have to be an expert in anatomy or physiology or kinesiology to help someone change their pain pattern or their situation or their overall daily quality of life. You can go in and do your massage thing and have it be very, very productive and highly technical without having all of that under your belt. Good things happen when we put our hands on each other. When you're choosing your continuing education, do you want to choose something that'll help you do that more, or do you want to go with the things that make you feel safe and comfortable? Would you like to be able to make a tremendous difference in someone's daily quality of life and how they feel, or do you want to keep up with the latest fads? With my practice, it tends to be very clinically based, very medically necessary, lots of disease pathologies, lots of injuries, things like that. And to me, that's a lot more exciting than doing just a basic relaxation massage. Relaxation is great, it's incredibly therapeutic, but when you can make a change in someone's pain profile, to me, that's changing someone's life. That's changing their quality of life, changing their ability to function, do the things that they need to do, like go to work, support their family, participate in daily activities or quality of life type activities, getting back to life as normal as we may know it after an injury or an illness or a problem that's been consistently occurring and been interfering with your quality of life. To me, that's what massage therapy gives me. It gives me the ability to work within those confines to change someone's life. So when I choose my continuing education, I want to choose something that broadens my horizon a little bit more, something that I feel might be pushing into my comfort zone just a little bit, so that I am somewhat confident in what I'm doing, but also challenging me that I don't know every aspect of it. So if I can be challenged with my continuing ed, something that's interesting, makes me learn something, makes me look at something in a different way, from a different perspective, from a different point of view, then to me that is incredibly valuable, because that's what builds my practice. I can add people to my practice that will be regular mainstays of my income generation, because they need me on a regular basis. And in order to function or come at a massage practice from that position, you have to be continually growing, you have to be continually learning, you have to expand your knowledge base for the next person that comes into your practice. You don't have to be intimidated to take on someone who might have multiple sclerosis, or might have Lyme disease, or lupus, or diabetes, or something like that. You don't have to be afraid of patients like that, because they come to you with a myriad of problems, but also some real quality of life issues that you can dramatically impact in very, very short periods of time. And that's why I became a massage therapist, so that I could change people's pain profiles, so that I could change their life, I could change their quality of life. To me, that's what's important. That's how I choose my education. Is it going to challenge me? Is it going to make me grow? Am I going to be able to help more people with this? Not am I going to be able to pay for this machine that I bought, or I'm going to be able to do weight loss wraps or wrinkle wraps or something like that, or the latest fad in massage. Fads are great. You can understand and pick up some great tools that way, but I would be way more interested in a treatment philosophy that allowed me to attract new patients instead of just the 3 or 4 I could get through a Groupon running a special. That's how I choose my continuing education. How do you choose yours?